try to overcome or get solutions. Peking University Africa Students Association, an embodiment of Peking University Africa students, is really pleased and honored to be one of the core drivers of this. And we hope that along the way, we shall attract more and more African students to join this drive across China. Peking University Africa Students Association remains the oldest and one of the largest African students associations in China. And we hope that we can always bring African students together in this and many other sessions to come. I'm really once again pleased and look forward to the discussion. Thank you so much.
Okay, thank you very much to the president of PUASA. Now we would like to hand over the floor to the president of Tsinghua University's African Student Association. Thompson, if you can hear me, feel free to speak.
Yes, I can hear you. Good evening, everyone. And it's a pleasure to have everyone here tonight. And I can also say good morning to our other guys that are joining in from other parts of the world. So it's today's program here, and the program is slated as a Afro-Sino Conversation Series. You know, like the PUASA president said, this is a particular event that is, you know, hopeful to like continue, even as some of us graduate and other students come, and obviously would be able to have an advantage of this whole program. Okay, good. So we're going to have 3 speakers, and this program is, you know, will hit a very, very interesting point and how far that Africa has gone into this COVID-19 issue, how it started, how it's going, how we hope that things will go and everything like that. So I would like to quickly go on with like before I introduce to us, I'll say that I'll introduce myself again as Thompson Nanaba. I'm from Ghana, and a second-year master's student of the Public Administration in International Development and Governance. So I'm at the School of Public Policy and Management. So I'd like to just spear straight into the introduction of THUASA. So the Tsinghua University Africa Students Association was founded in 2017, and the official launch was held on the 25th of May 2017. So everyone may ask, like, what is actually THUASA? Like, what is our primary orientation? So our primary orientation is education, and we hope that education could drive the continent forward. Education could be the key, you know, to the master key to help the continent drive forward. So in our association, you know, right here on Tsinghua campus, all African nationals are admitted into a program of study into the Tsinghua University, and have registered with THUASA, obviously part and parcel of this association. So, and any other national of our host country, you know, China, and or any other country can be a member, you know, but cannot or would not hold any executive, you know, position for the association. And we also have our affiliates, you know, coming in from other countries like Vanuatu, and they are all our brothers and sisters right here on campus. So I'll just go through just like 2 or 3 of our aims and goals. Like I said, the obvious one is education. Like the second one is us having like to protect and safeguard the rights of members, encourage democracy and equality amongst members, share ideas, educate members on building careers in China, promotion of cultural exchange, promotion of cultural, social, religious tolerance amongst members and other students, and also encourage positivity amongst members. And the structure of an association drives straight from the president, the vice president, the general secretary, organizing secretary, treasurer, or the financial secretary, as well as the communications officer. So, so for this particular event, we are hoping that the top 2 tier universities, or top 2 ranked universities in China, in partnership with the Reimagined Africa, which is the consultancy organization in international development, to bring you an online event geared towards, you know, providing a current assessment on the status of the African continent in regards to the impact of COVID-19 in the region. So I believe that having our moderator, Albert Mhangami, my very good friend, my very good brother as well. We have a team together that we play football, and so he's our goalkeeper, and he's good at what he does on the pitch as well. So I believe that we win matches sometimes, due to his capability and everything, and we hope that he can moderate this event to the max, and everything will be perfect. And thank you again, Albert.
Okay, perfect. Thank you very much, Thompson. It's great to hear from both presidencies. As we said before, this is an event where we're trying to collaborate with the two in China. Tsinghua and Beida are seen as the peak of academic excellence. And so we would assume as well that the African students in these communities really can provide really strong conversations. So we really appreciate it. Another organization that is involved is Development Reimagined, and I will quickly just go over who they are. So Development Reimagined are a diverse and multilingual team of consultants with expertise in fields of international development, diplomacy, environmental and public relations, all in all regions of the world. Their thematic areas of expertise include international development, projects and programs, trade statistics and trends, development effectiveness, China's economic and poverty reduction experience, international relations analysis, African development and current markets, agricultural markets and strategy, sustainable cities, transport and urbanization, foreign aid trends, South-South cooperation, migration statistics and trends, industrialization, green growth, climate change planning, private sector development, and finance and investment. And this is quite comprehensive, and you can see this in their work. If you are able to, please check out Development Reimagine's multiple social media platforms as well as their website. They provide remarkable statistics that I've used even in my own work in terms of research. So it is an amazing organization, and we're glad to have their speaker here, Ovigwe, who we'll be discussing today. We'll actually go into an introduction of the speakers shortly. But first, we also do have a special guest here. She is Professor Liu Haifang, and if she's available, we would really like to hear from you. So if you are available and you're comfortable to, please open your mic and camera if that's possible. She's the director for the PKU Center of African Studies. Professor Liu?
Albert, maybe she will give us a brief introduction later on.
Okay. That works perfectly then. So we'll definitely wait for her then. In the meantime, we can go right into it. We are 2 minutes a little behind schedule, but that will definitely be readjusted. For everyone who is part of the audience, this is going to be a discussion later on. For now, we would really appreciate that you would hear the speakers out. There won't be any interruptions while they're speaking due to time constraints. But the speakers will be available in the last section, and that's why it would be important right now to show you the structure of how this discussion is going to go. And so basically what we're going to do is we're going to go through 4 stages in this conversation. The first part of the conversation will be led by Development Reimagined, discussing the status of COVID-19 on the continent. And normally a comparison of the international community might be included as well. Then we will be moving to livelihoods, where PUASA will really help us engage the conversation of how there are social, political, and economic concerns to take into account. And then finally, THUASA will bring us into a conversation of lives, of what happens in terms of health concerns and moving forward. And the last section is the largest section, which will be about discussion. And we would hope that you can engage with our speakers. So feel free to write down questions even in the comment section available on the platform, as well as on your own personal notes. And then the floor will be open for you to engage in conversation. So without further ado, I think we will dive into the conversation. Unless Professor Leo is here, I think we might let her speak at the end if she isn't yet set. I'm not seeing any green thumbs, so I think we will begin by introducing our first speaker. And our first speaker here is Ovigwe Eguegu, and he is a remarkable speaker, a remarkable researcher from Development Reimagined. He's a policy analyst at Development Reimagined, and he specializes in geopolitics, China-African relations, and he's a contributor to the Africa Report, China-Africa Project, and Foreign Policy Magazine. He has been in many interviews and discussions on Africa, ranging from local ones to much larger international televised sort of conversation. And so we really appreciate him being here today. So Eviwe, the floor is yours. Feel free to speak and open your mic as you see fit.
Yeah, thank you, Albert, for that very kind introduction. I'm really pleased to be here to join you guys today, particularly in the continent of Africa and how it's really, impacting lives and livelihoods. So it's quite an honor for me to be here, and I look forward to having a very interactive and engaging conversation with you all.
Okay, thank you very much. We are seeing a little delay, but it seems like the network is picking up well. Our next speaker will also be from Beta, and this is Lukmon, and he has served as a policy research intern at the APCO Worldwide Beijing office. He's pursuing a master's degree in China Studies, and his focus is on politics and international relations at the Yenching Academy of Peking University. He is the founder of Conflict Free Nation, a nonprofit that promotes sustainable peace and security in Africa. And he currently hosts Africa Security Talk, a podcast that analyzes African security challenges. I have already just had a quick look at some of his research, and he is a remarkable scholar, and so we're really excited to hear what he has to say today. If you would just like to say a short introduction of yourself, that would be great.
Thank you, Albert, for having me. Hi, everyone. I'm Lukmon Akintola, like Albert rightly said. It's my pleasure to be here representing PUASA, and I look forward to having an interesting conversation, and more importantly, to see how we can discuss some of those teaming challenges we are facing in the continent, and how this conversation we can come up with some valuable recommendations at the end of the discussion. Thank you for having me, Herbert.
Excellent. Well, thank you very much. And so we will move also to the next speaker as well. And this is Chomba Lufundisha, and he is currently a third year at Tsinghua University. He's a bachelor student, and he is the Beijing International Christian Fellowship Dance Ministry Coordinator and THUASA's dance team coordinator. Yesterday, for example, they danced at the gala, the Tsinghua Gala, and it was a really remarkable performance and got a lot of response that was positive. But he also used to be the public secretary of the Association of Zambian Students in China, and he is not only a notable participant in THUASA, but also a notable presence in the academic community. Chomba, if you have a second, please feel free to introduce yourself quickly to the audience.
Greetings. You're able to see me? Good evening, everyone. I'm Chomba Lufundisha from Zambia, as Albert said, and I'm very glad to be here. Thank you for PUASA and THUASA for the opportunity to come and speak today. And I look forward to it. I think we have a lot of topics to talk about as a continent in regard to health and the pandemic, and I'm really excited to see what will be presented here and just to air out some of the research that I did and my views on how we can go about solving some of the major issues in our continent. So thank you so much.
Okay, thank you very much, Chomba. And so in line with our schedule, we will now immediately move first to Ovigwe as the speaker. So please, Ovigwe, the floor is yours. You can continue.
Yeah, thank you. So, I mean, COVID-19, I think this is one year that we will not forget in a hurry because of the very many events, and I think particularly the pandemic, remarkable thing to happen this year and even many years, before now. So when we had the first case of, COVID-19 in Africa, it was in Egypt. It was quite, traumatizing for many people outside of Africa and even within the continent because of the concern of Africa's health infrastructure, which isn't so great, capacity for government to respond to what seemed like a very serious public health emergency. You could look at what was going on in China, how they were able to regulate lockdown, provide essential services while the lockdown was still going on, like food, access to food, groceries. So there was a lot of concern in the content concern for Africa and in Africa about how we are going to respond, and it was a very unique time, I would say, because many of the ministries of health in the continent, I'm very sure that the ministers of health did not expect what was going on when they were giving their job or their portfolios, or what we're going to go through when they were giving their portfolios. So when it broke out, I think one of the things you have to look at now, for instance, you'll find that the total number of cases, in the world is about 71.2 million, right? And 1.6 million deaths. If you compare that, to Africa, we have, total confirmed cases of 2.3 million, active confirmed, total confirmed cases 2.96,000.9 million, and confirmed deaths 55. Now that is a fraction of the global confirmed deaths, and if you consider Africa's population of about 1.2, it's almost as if nothing is going on here, or we're not having a health crisis in a sense. And in many ways, we really aren't. What you would find, in the media about COVID-19's impact in Africa seem more like an economic than a public health problem. But but again, the numbers doesn't really tell the entire story, because while we have total confirmed cases to be 2.3 million, the fact is Africa is not testing effectively and widely enough. Africa accounts for just 2.2% of tests worldwide. That is huge, right? So, and of that if that 2.2% of total tests worldwide, only 14 African countries account for 80% of tests completed in Africa so far. 14 countries, and the leading countries that are doing the most tests, South Africa, Morocco, Ethiopia, and Egypt. So, if in a sense, we can't really say we have the full picture when it comes to the total number of people that have coronavirus, the novel coronavirus in the continent. However, it does not mean that even if the total number of cases is not perfect as it were, the number of deaths on the continent is not unusually high. So that the number of deaths that is being recorded. So oftentimes we find that people will always dispute Africa's numbers. Yes, of course, we know we're not testing well enough. I mean, there's an unusual increase in deaths in the continent. That's nowhere to be seen. So if for instance you look at Nigeria or just about any African country, the trajectory when you're looking at death per month.
Hi, Ovigwe, can you hear me? Sorry. Do you mind switching off your video? Unfortunately, seems to be some problem with the network. So maybe switching off your video might help because we're only getting some parts of.
Okay. Okay.
Thank you. Sorry for interrupting. Please continue.
Is it better now?
Yes, I think so.
Yeah. All right. So if we look at the total number of the graph of death in across Africa, many African countries, there isn't really been any difference. So, I mean, a good example would be in South Africa. During the first few weeks or even the first month of lockdown in South Africa, total number of deaths from all causes actually reduced, right, under lockdown while they were dealing with coronavirus, right? So the number, as I was saying before, the total number of cases might be disputed by confirmed cases might be disputed by so many people to say it's not a true reflection of the number of cases on the continent. But the point I'm trying to make here is the deaths does not, even if the number is higher than what we are reporting, there is no corresponding increase in deaths from COVID-19 because as it is now, many countries still have about the same mortality rate as that they did before COVID-19. So what is the explanation? And I think so it becomes really interesting to look at the explanation. Why is it that we don't have the kind of, I would say, figures that are coming out from Europe and the United States? And there are real reasons for that. One of them is quick action, right? So the first case on the continent, like I said, was in Egypt. It was on Valentine's Day. You can imagine that Valentine's gift to us was February 14th in Egypt. And when that case was reported, right from the very beginning, most African governments took drastic measures to try and slow the spread of the pandemic. Immediately, we started hearing of public health measures advising people to stop handshake, increase washing of their hands, social distancing, and wearing masks, in public. Lesotho, for instance, as a very good example, actually went to lockdown before they reported the first case. They declared an emergency and closed all schools about 18th of March, went into a 3-week lockdown. About 10 days later, along with many other African countries, they were already on lockdown. It was days after the lockdown was lifted, in early May. That was when Lesotho confirmed the first case, of COVID-19. So you just have to give credit to the African countries and their governments when it comes to quick action. So as it is now, Lesotho has about 2,214 cases and 44 deaths in a population of 2 million people. So you cannot rule away that swiftness in action when it comes to how our COVID-19 has impacted the population. There are other factors like even public support for government measures. Many African countries saw compliant public. You would find in Nigeria, for instance, there were so many people who really complied initially. Now people are getting a little bit complacent or lackadaisical, but initially there was serious compliance across. Don't go out. No, people don't go out. Wear a mask. Almost everybody, were putting on their mask and adhering to the measures, social distancing, and all of that. So that compliance and that willingness to respect authority figures and the experts is another factor that just has played a vital role in the numbers we're seeing or the impact of COVID COVID-19. Then, of course, there's the youthful population. So globally, people that have died are over the age, most of the people that have died are over the age of 80. And if you look at Africa's median age, which is about 19 years, it gives a picture of some form of demographic advantage. Only 3% of Africans are over 65 years old. So, and if you have, majority of the population that are more susceptible to being over 65, and you have only 3% of Africa's population being over 65, of course, the population is not as vulnerable, right? So there is also that issue of age. And then the next factor I think is really important is the community health system, which is good. Now we don't have the best healthcare system in the world, but what we find is that at the community level, there's strong emphasis on community health and primary health care infrastructure. Soft infrastructure is very, very good, thanks to Africa's government and also the WHO, which has really contributed a lot to building infrastructure and a very solid community health system. In Nigeria, for instance, there was a quick mobilization of existing polio personnel, tracking contact and conducting follow-up visits. So while hospital infrastructure in much of Africa is not really developed as another part of the world, the continent's strength, has shown to be in its tried and tested community health system, and that's because we've always had several health issues to deal with, whether it was Ebola, or polio. This has kept the public health system on a perpetual drill, as it were. So there's always, I would say, infectious diseases from spread, or even non-communicable diseases. So that constant exercise made it very easy for the healthcare system to mobilize down to the community level, which is not the case for many parts of the world, particularly in Europe, where they don't have to deal with epidemics or outbreaks of infectious diseases, like Africa. So of course, there's also the case of favorable climate. A study conducted by researchers in the University of Maryland in the US found a correlation between temperature, humidity, and latitude with the spread of coronavirus. So that has really really been another part of the factors, or another factor that is very, very, very important. So it's not necessarily, from look of things now, a health crisis. It's more of an economic crisis, because revenues have dwindled drastically. Many African countries have burned through their forex reserves, and we're seeing some debt distress, but there's no debt crisis, as you would hear a lot of people talking about in international media. Oh, Africa has a debt crisis. There's no debt crisis. Zambia is the only country that's defaulted in its debt. And looking at 55 economies, just one country has defaulted. So that debt crisis narrative doesn't stand up to scrutiny. However, there are 5 African countries: Cape Verde, Mauritius, Tunisia, South Africa, and Mozambique, that are expected to exceed their highest levels of debt historically, based on their own respective, debt to GDP ratios. But for the majority of African countries, they are having a revenue crisis, or a growth crisis, I would say, not necessarily a debt crisis, because the last major debt crisis in Africa, if we're going to use that as a template to judge the present, was in the 90s. We're not anywhere, we're not really close to what happened in 90s, by and large, today. So it's the revenue shortfall and slow growth for the foreseeable future is disconcerting, but we can't really say we have a debt crisis. So just to wrap up, we've got the pandemic ongoing. We hope to get access to vaccines, And thankfully, we're seeing that there's a cold chain that has been set up by China with working in collaboration with Ethiopia Airlines to give our African access to vaccines because we don't have to be at the back of the queue. And that would really help to give up because we have a case, we needed vaccines so that the business people and the general public can travel because we're seeing there might be restrictions to travel. So while we don't need the vaccine necessarily to protect majority of the people from dying, we actually need the vaccine so that we can get transport and connectivity moving again between African countries. So yes, we have coronavirus as a problem in the continent, but it seems to be impacting Africa more as an economic problem rather than a health crisis. That's not to rule out the health impact that we're also seeing on the ground here. So thank you so much for giving Development Reimagined and myself the opportunity to speak at this event. I think I could pass on to the next speaker now.
Okay, thank you very much. Very insightful conversation there. I'm sure there's a lot more questions to be brought out to extract more sections of that. But I noted here that you did mention that the main focus here is an economic conversation with COVID. And that definitely is a good segue and an important segue into introducing our next speaker, Lukmon, who, if you are ready, please, the floor is yours, and we are happy to hear what you think about livelihoods and COVID.
Thank you so much, Herbert. Thank you so much, Ovigwe, for that robust presentation. And that, I think, you have laid a very good template for what I will be saying here. More importantly, you have been able to establish that this is more of a of an economic crisis rather than health crisis for Africa, and I totally agree with that. However, I will also be expanding it beyond the spectrum of economy. I will be seeing it from social perspective, from security perspective, and also see some issues that have erupted. So basically, some of them are not directly connected to COVID, but there are basically some knock-on effects when we are discussing the issue of COVID-19, which we definitely need to also discuss when we are having some of these conversations. How about, do you mind having me pull up my my slide? How about? Okay. Can I share it or you will help me?
Yes. Oh, would you like me to? You can share it. Please go ahead and share it.
Okay.
Or would you like me to share it? It's up to you.
Please do from there. You can help me share. Okay.
Yes. Sorry, give me one small second.
How about, are we sharing? Oh, looks like, how about?
All right,
Okay.
1 second. It just glitched. It's okay. I'm about to share it now.
Oh, okay, okay.
Okay, and there. It should be available. Can you see it? Okay.
Yes, I
Please
can
go
see
ahead.
it. Thank you. Thank you so much. Yeah, you can just go to the next slide directly. So I'll be talking basically about the livelihood, which of you guys been able to talk about the status of the continent. I'll be talking about the livelihood. So I will be just lay some few background, talk about the economic concerns, the social concerns, give some recommendations, and it's basically opening up for discussion after we are done with this. Can you go ahead? So basically, what I try to do, this is just touching upon what Ovigwe said earlier, just to tell us what exactly is the African CDC saying about the status. So right now we have 2,325,710 reported cases. So the death tolls and the recovery cases is also very good. So the Southern Africa is actually having the highest cases, while the Central Africa is having the smallest cases. So this this is actually just showing the trend of COVID-19 in the continent. But to go to the topic, what exactly is what are the implications for the continent? Can you go ahead? So what I try to do is to look at it from three major angles: political concerns, economic concerns, social concerns. So I won't really dwell more about the political concerns. I will touch more light on economic and social concerns. So, but because politics is very important, so I would actually be bringing out some political concerns that are actually intertwined with other concerns that I was able to bring out. So for social concerns, we'll be looking at the traditional security and basically non-traditional security. Can you go ahead? Yeah, thank you so much. I think, again, it is very imperative for us to understand that some of the challenges that we're bringing out here, they are not just caused by COVID-19 alone. Some of them have been existent. So the only thing is that COVID-19 just came to exacerbate some of these challenges. However, for economic concerns, for everybody that follows the African continent very well, you know that 2020, moving to 2020 from 2019, we were all happy. We were so optimistic about the growth that would come up in 2020. Reason being that we were looking forward to AfCFTA, the African Continental Free Trade Agreement. We are looking forward to it. There is also the Silencing the Gun project by the African Union. So there is a whole lot of optimism, and also knowing that US election is going to happen. So there is several things, several optimism coming up, and we all thought that the economy is going to bolster, especially at the continental level. However, COVID-19 erupted and everybody had to just close down the borders. State governments need to take some drastic measures, which, like Ovigwe rightly said, our experience dealing with Ebola, polio, and all sorts of epidemic in the past really assist a lot of state governments in addressing some of these issues. However, we had a whole lot of economic challenges because about 60 to 80% of African population actually work in the informal sector. And what this means is that most of these people, not all of them get salary, they live on wages, they live on remittances. So it's basically, we call it from hand to mouth. When they sell, they make little thing on daily basis. This is what they use to assist and to live on daily basis. So, but shutting down the means of transportation, asking them to go in to close their businesses, this actually had a whole lot of impact, significant impact on their daily lives. And this was not so easy for a lot of Africans in terms of what their economic survival. And there are some statistics I was able to pull up here just to give us a sense of what the African continent is actually facing economically, because it is very imperative you understand that economy is the backbone for any society. So it is very important, and that's why moving forward to 2021, we expect some improvements. For FDI, statistics shows that this pandemic has led to a decline of FDI by 40%, which basically, this is from the World Bank, showing that and this is actually expected, because when the supply chain has been cut off, a whole lot of everybody is actually trying to close their borders. So this means that investment won't come in, and there is a whole lot of not so sure of what exactly they are going to make. So, and again, state government just need to ensure that don't export the virus into our own country. So this is, and also trying to contain the pandemic within the continent. So this actually led to decline of FDI, and also jobs were lost. Jobs were lost, about 30 million jobs. 49. Again, another statistic also shows that 49 million Africans are to be pushed into extreme poverty because of this. This is actually a projection. This is not actually what is happening now. This is a projection. And what this means is that African leaders need to be swift. We understand there is a whole lot of things, like Ovigwe rightly said. While we don't have, while at this moment, most African countries, they are not in debt crisis. However, there is still a whole lot of reduction in annual revenue. And what this means is that, for instance, Nigeria just slip into recession. South Africa exited a couple of weeks ago. So, and they have been in recession for about 2 quarters. So this means that there is still a whole lot of issues that we need to address economically. So, and McKinsey had actually projected also that this pandemic will lead to the decline about 2 to 3% in the GDP of Africa in 2020. So this is another form of prediction that was done by McKinsey. So again, like I rightly said earlier, most of Africans, they work in the informal sector, both in the farm sector and non-farming sector. So just to survive. So this pandemic really affected their livelihood. And again, there was a survey that was done by World Bank on 4 countries, Nigeria, Uganda, and I think Nigeria, Uganda, and 2 other countries I can't remember now. And from that survey, they said 256 million people, 206 million people lost their income due to the pandemic. And this represents 77% of these 4 countries. So this is to tell you how significant the strict measures that were taken by government affect people's daily livelihood. And all these things that we are talking about, it becomes very difficult for state government or even for national government to actually put up some effective measures on how to address, because we don't really have reliable data in the continent. So today, most data will say that we have 1.3 billion population. So these are data. However, specifics on country levels, we have a whole lot of issues as regards data. In Nigeria, for instance, there is a whole lot of data deficit. And this is one of the issues affecting or not making the government to be able to take effective measures or effective intervention project. Because if you don't have data, how do you know who gets what and who do you give what? So there is a whole lot of problems regards data. And again, this means that safety nets that were actually issued by government didn't get to right hands. So the people that actually need some of these measures didn't get them. So it's and because of existing spate of corruption also made it very worse. And this really affects people. And it's a whole lot of issue economically for ordinary citizens in the continent, because most people couldn't afford, couldn't go out to work. And even after most countries relaxed the lockdown, the economic activity was still not okay, because borders were not open yet. When borders are now open, the restrictions are still a lot. Now, I will now just to look at this graph. Like I said earlier, as you can see, one of the things that is actually highly affected in terms of income loss, you will see it from these 4 countries: Ethiopia, Malawi, Nigeria, Uganda. You can see there is a whole lot of wage income loss. So there is huge income loss from wage income, and also farm income also was actually there's a huge loss from farm income. So what we didn't really see a lot of loss is remittance. So remittance from probably people sending money from one part of the other is not as huge as farm income, as wage income, as business income. So, but this is just to tell you the spate of income loss that happened within the continent. So this is a data from the World Bank. Next. So also, when you also look at this, another economic concerns, I already said it earlier, Nigeria slip into contraction. So there is a huge issue in terms of people also losing their people also losing their jobs, and this also means that people from the urban area, from the rural area, so there's a whole lot of job loss and people were being laid off. So these figures shows that one way, and we should know that this is actually not restricted to Africa alone. From other parts of the world, people were actually affected deeply by the pandemic. Can we go to the next one? Now, social concerns. So not to stress much about economy. So on this page, I actually call it knock-on effect. So what I try to do is to split them into traditional and non-traditional security issues. By traditional security issues, so one of the challenges that we saw during the pandemic and even the post-pandemic, again, this does not mean these issues are not available, they were not there before, but they were actually exacerbated by the pandemic. Of course, terrorism and insurgency became heightened. We actually now see, just a couple of days ago, Boko Haram went to the farm in Maduguri. They slaughtered about 40 farmers. So, and these are also leading to internal forced displacement. Some of these issues are also leading to refugee crisis, so causing humanitarian crisis within the continent. So displacing people from one part of the country, and of course, they keep wreaking havoc. Again, when you also see internal unrest, civil war, basically. So some would say that the issue in Ethiopia, while this might not be directly linked to the pandemic, however, you can see that these are some internal unrest happening. However, you can also see communal violence. Communal violence in terms of you see banditry, you see banditry, you see thuggery, all these things are a lot, and people that actually move on the road normally do things normally, but because of strict measures, this had made them became most of them became more harsh, some of them became more rogue, and we see some of these things in Nigeria, in Kenya during the lockdown. So these are some security issues and political instability. We start seeing some corruption cases coming up. For instance, we saw what happened in South Africa, that they siphoned some money that was supposed to be used to address the pandemic. Again, human rights abuse. This is basically huge. Ovigwe mentioned earlier that most African countries rose up some of this, which is very, very good. However, in the process of trying to address the pandemic and forcing people to stay at home, people were a lot of people were abused. In Rwanda alone, about 60,000 people were punished for not staying indoor. So, and again, we also see the issue of in Nigeria and SARS. So these are some of the issues, even in Uganda. So these are issues that happen in terms of traditional security issues. Non-traditional issue, you can talk about food insecurity, and this is actually huge because the supply chain were cut off by a lot of these measures, and this really affects people's food because farmers couldn't take some of these things to the people, and again there is lots of jobs. And right now 70%, according to the data, 70% Nigerians suffer from food insecurity because of the pandemic. So this is a major issue. Also gender-based violence, and this was actually heightened a lot. In Mali alone, 35% increase in gender-based violence during the lockdown. And this is compared to 65% that happened during Ebola period. So there's a whole lot of issues. And one major issue that also erupted a lot was the neglect of other health concerns. People with HIV, people with diabetes, people with ulcer, all these people were not attended to because of the virus. So because most the health practitioners, the government, they are all still focused on coronavirus. Why people with other these things, they are all afraid. Some are even afraid to even go to hospital because they believe they would actually say they have COVID-19. So this is also actually causing increase in mortality rate. Can you go ahead? So considering all these things, so this knock-on effects, this economic crisis, so how do we address them? I'm not saying that this recommendation is exhaustive enough. It is just a little bit, and a lot of us can still make our recommendations. However, I feel like we need effective and inclusive policies, inclusive in the sense that bring in the right stakeholders, connect with the people, connect with non-profit organizations, people in the private sector, and look at people in the informal sector, because these are the drivers of our economy. We need to ensure that they are being focused, and although there needs to be political will. So we must understand that if there is no political will, how do we address some of these issues? Also, building sustainable partnership. This means that partnership both within, domestically and also internationally. Partnership with China, partnership with other organizations, countries that will be part of this. Also, human security should be a key priority. Gender-based violence should be addressed, human rights should be addressed. So all these things, and of course, education should also need to be addressed. And more importantly, we also need effective and reliable data. There is no way we'll address the challenges the pandemic has brought upon us if we don't talk about effective data. So this means that effective data needs to be the drivers of any intervention project. So in all, I feel like economic challenges, security, food insecurity, food crisis, everything that has been caused or exacerbated by this pandemic, it shows that we still have a long way to go in the continent. However, I would also say that we are not doing bad. AFCT is about to be launched by January 1, 2021. The Silencing the Gun project is still on, and that's at the continental level. But at the state level, in terms of specific country level, state leaders need to understand that there's still a whole lot of work to do, but they can't achieve it alone. They need to work with the necessary stakeholders to achieve the desired goal. I will stop there for the next speaker. Thank you so much for having me.
Thank you very much. That was a remarkably well done presentation. And so now I think we will move to the next speaker. We're still just a little over time, but Chomba, if you are ready, please feel free to share your slides and screen.
Am I clear? Can you hear me?
Yes, yes, you are.
Oh, awesome. Just opposite to share my my slide. Let's see. Okay. Everything in place? Can you hear me? Can you see everything?
Yes, you're good to go.
Oh, okay. Thank you so much for the invitation to be here. I'm going to be presenting on the health of the continent in regards to the vaccine, the COVID-19 virus vaccine, and what it means for our continent, and also how the internal health infrastructure of Africa looks going forward as a whole. So the world is in the midst of a COVID-19 pandemic, and as a World Health Organization and partners work together in the response, including tracking the pandemic, advising on critical interventions, and distributing vital medical supplies to those in need. They're also racing to develop and deploy a safe and effective vaccine. So before I proceed to the next page, I'd just like to introduce how a vaccine works. I guess it's high school, but why not? So vaccines save millions of lives each year, and they work by training and preparing the body's natural defenses, which is the immune system, to recognize and fight off viruses and the bacteria they target. And if the body is exposed to those disease-causing germs later, the body is immediately ready to destroy them, preventing illness. So what do we know about this vaccine? Well, according to the UN World Health Organization, there are currently more than 50 COVID-19 vaccine candidates in trials. And the World Health Organization is working in collaboration with scientists, businesses, and global health organizations to speed up the pandemic response. When a safe and effective vaccine is found, the World Health Organization will facilitate the equitable access and distribution these vaccines to protect people in all countries. People most at risk will be prioritized, countries like the United States, Brazil, India, and while work towards rolling out a safe and effective vaccine is being carried out, it is still very imperative for public and personal health preventive measures to remain implemented. So the frontrunners in the race for the development of this vaccine is PHTSA, which has its headquarters in the United States of America, and BioNTech, which has its headquarters in Germany, and both have reported a success rate of over 95%. This goes to show that though not yet complete, significant progress has been made in the development of the vaccine, and its completion is on the horizon. So in regards to readiness on how it's going to be distributed, the World Health Organization, UNICEF, and partners are working together to help prepare countries to be ready to introduce the COVID-19 vaccine, and adaptable guidance, tools, training, and advocacy materials are being developed to support countries in preparing for the vaccination. There is also there's going to be the introduction of the vaccine readiness assessment tool, which includes an Excel template for countries to complete and cover note. The VIRAT which is short for the vaccine readiness assessment tool, is intended to be used. Intended to be used by ministries of health with support from World Health Organizations and UNICEF country offices. It provides a roadmap for countries to plan for COVID-19 vaccine introduction and a structured framework for countries to self-monitor their readiness against key milestones. Countries can use the VIRAT to identify areas where support may be needed. COVID-19 vaccination training packages will also be there, and they will include a blend of online learning modules, materials for in-person trainings, and job aids. Initial training packages will focus on health workers and the national focal points for COVID-19 vaccine introduction. So what does this mean for the continent of Africa? Well, firstly, adequate preparation by African countries will need to be carried out, and it will fall on the leaders to educate the citizen on the importance of the vaccine and the procedures that will need to be taken in order to acquire and safely distribute the vaccine. The population will also still need to maintain the health precautions, such as maintaining clean hands, face masks, and social distancing before its distribution and for a period of time afterwards. And this also serves as a wake-up call. Political independence in African countries has been achieved within the past 100 years or so, 50 to 100 years. But the same can't exactly be said for economic and financial freedom. And the pandemic has been almost an acid test, to just put this plain out, you see, because there's very little investment that has been made into scientific research, and the pandemic has really just brought this to light. So how does our health infrastructure look going forward? And this is the latter part of my presentation today. So we can begin at taking a peep at the pandemic's numbers in Africa between January and October. Africa had the lowest recorded cases of all the continents. While these numbers may be questionable due to the lack of large-scale testing in the continent, the number of recorded deaths due to COVID-19 also seems to favor the continent. While it is yet to be proven whether that was due to geographical or genetic reasons, it is mainly due to that response that most countries, it is mainly due to that rapid response that most countries had to the outbreak, implementing lockdowns and social distancing, and urging their citizens to observe safety precautions and preventive measures to stop the spread of the virus. The continent, which has had a population of more than 1 billion, has had about 1.5 million cases, according to the data compiled by the Johns Hopkins University. These figures are far lower than those in Europe, Asia, and the Americas, with reported cases continuing to decline. While this while this response deserves to be commended, the little support given in research conducted in search of a vaccine by the medical institutions on the continent epitomizes an inherent problem. Many healthcare systems in Africa are very passive, and it has been demonstrated in the previous outbreaks that we've had in the past. We were not ready for the AIDS pandemic. We were not, and the same can be said for the Ebola outbreak. And that has been repeated by the COVID-19 vaccine. And looking forward, we've had 3 outbreaks in the last 20 years only. Are we ready for the next one? What are our governments doing in order to prepare for these outbreaks? Are we just waiting to respond, or we're actually taking the fight to the front line of the viruses? You know, like not really just waiting to respond to certain outbreaks and everything, but really going out there and looking for them before they become outbreaks, before they break out. So the issues to be addressed going forward, if our health system is going to improve as Africa, as follows. Just divided into 2 parts, really not exhaustive, but some of the main issues that will need to be addressed are the governments will have to increase on the availability of hospitals, like provision for hospitals, transportation, and subsidies to make these services accessible by all will need to be implemented, and all those aspects have to be improved, as well as facilities for the less privileged. And in regards to awareness, this is the part where the governments will have to interact with the population to make sure everybody knows what is going on and everything. So we'll need adequate training for medical staff, as well as better living and working conditions for them, because they are really out there fighting at the front line for us. And there also need to be frequent communication between the citizens and the health ministries, not only in times when there's an outbreak such as this, but when there are blooming dangers, certain diseases that might be dangerous to many people, but are really not that common to be found. Like that, there has to be platforms where governments can really, through their health ministries, just interact with the citizens and sensitize everyone on these issues. And finally, but not least, we have the research facilities. There's really very little research that is done in this aspect when it comes to our continent, and it's really saddening because we're almost sitting ducks at the next outbreak that might occur. You know, God forbid it comes, but we still have to prepare. You know, like I said, the continent has been hit by 3 pandemics in the last 20 years. We ought to be more prepared. And with that, I'll end my presentation. Thank you. Special thanks to THUASA and PUASA for the opportunity to speak on this topic, and thank you all for listening. I'm done for now. Albert?
Great job, Chomba. Thank you very much. That was a brilliant presentation. We really enjoyed it. A lot of questions definitely now available for discussion now that we've seen the entire topic. If you are willing to take down your slides, I will bring.
Gotcha.
Okay, so this has been a really great conversation so far. So far, I hope our audience have been paying attention. Just a quick preface before we go into the discussion section now. We've basically discussed the status of COVID on the continent. We've moved now into a dialogue about COVID in terms of its economic consequences and political and social consequences. But now we have finalized with Chomba giving us a particularly nuanced conversation about what this means for the health systems of Africa. What are the considerations when we take into account moving forward? And also not just in terms of health, but in terms of infrastructure. And so at this point in time, I would really welcome everyone to maybe write down a question or two that's available to them. And as we do so, I would like to see if Professor Liu is available just to say a quick hello and introduce yourself. We are really glad to see that you're here. But if you are not ready at this point in time, we can also continue after the discussion section. So Professor Liu?
Hello. Hi, Albert. I apologize. I didn't have electricity for my other computer, which has full equipment for this Tencent meeting app. So here I only have the voice available. I apologize. But thank you for inviting me to speak, to greeting people, basically. I actually just pick up the news this afternoon rather late about you are going to hold such an event, which is really amazing. Since COVID happened, I think it come to every bottom of my heart of I mean, though as a Chinese, but as an Africanist, African study scholars in China, I really pay close attention to these issues and what has been really discussed for this evening. I can say you as scholars doing studies in China, you have been really I mean, it's of course definitely didn't only like me pay an academic interest, and then of course you this your home, and then you are really you know, closely looking at what might be the impact. And then so like the three presenters rightly pointed out, it's not only a health crisis, it's more about a social as well as deeply, profoundly affected Africans' economic crisis. So, so far, I think we have done so great job. The three presenters have unpacked the issues so well. So I guess the audience already pick up enough information to understand. I specifically want to mention just several words about the vaccine. For the vaccine, I do think it's I think yesterday I was listening to Dr. Zhong, who served as a director of African CDC, Center for Disease Control. And he was mentioning, I think for me, it's a kind of a heartbreaking voices. He was saying vaccine for Africa is a moral issue, which the whole world we have seen the available vaccine is going to the global north, and while African so far you know, very little hopes to have early batch of vaccines, and we only heard news this morning that Chinese vaccine already arrived. The first batch arrived in Egypt. So the whole continent is still hungry, still really looking forward to have a more this kind of availability, accessibility for vaccine. But as Dr. John rightly pointed out, if the whole world want to still going to engage Africa, specifically to re-engage Africa in terms of economic, they cannot leave African behind. So in which way either aid or other means to help African to access vaccine is still crucial issues. I really enjoy the three presenters. They make things so clearly, and also I do feel that's deep concerns from all of you. And I also think today's participations also have those deep heart, loving Africa, expecting Africa getting better and then cure this impact. So I stop here. I thank you for organizing such an event, also allowing me to speak a few words as a Chinese Africanist and sitting in Peking, you have the privileges to closely working with you, and then today particularly to listen to you. Thank you.
Thank you very much, Professor Liu. That was a very intriguing and interesting point, especially about vaccines. And I think that opens up the floor now to questions. Feel free to write your questions in the dialogue box available. One interesting question already has been asked, and I'll read it by Nathan Diwa, which writes, "Thank you for your time and for those informative presentations. I have a question. The PRC has obviously succeeded the introduction of a vaccine. The Europeans and the US are similarly creating their own vaccine. Are African countries interested in using vaccines introduced by, per se, China or other nations, or is there any call for the creation of an African vaccine? Thank you." So this is a very interesting question. I think all panelists feel free at this point to turn on your cameras, as well as feel free to respond to this question. But this question isn't only limited to our panelists. If you have a relevant response or believe you have a relevant response, please feel free to continue the dialogue in the dialogue box, but please preface it first with the name at Nathan Diwa, for example, to help us sort through the questions. So please, panelists, if you don't mind, once again, responding to this question. I think the most relevant response probably would go straight first to Chomba, if you would have a response to this.
Oh, that's a really that's actually a very important question, Nathan. And so are African countries interested in using vaccines introduced by China or other nations, or is there any call for the creation of an African vaccine? Well, there's a call to develop a vaccine on our own in the first place, you know, because for the most part, and like for things like pandemics and everything, like the outbreaks in regards to, like, maybe when you talk of polio, we had malaria, we had all those things, you know, all those things, things that really affected us directly. And it took Western intervention, both Western and Eastern intervention, to kind of like bring everything to something that we can control. So to answer your second question, is there any call for the creation of an African vaccine? Yes, there is, but by who, right? It works well, and we are used to it, where we have a vaccine brought to us and everything, but we should be able to create our own, you know, which was, I don't know if you caught it, but that was the heart of my presentation, to say we need to be able to respond to such things on our own as well, you know, because each and every single time we have such a health problem, we have to rely on philanthropists like Bill Gates and Barack Obama to kind of like come and tackle these problems, like, specifically. So there is a need, but whether or not Africans are willing to use vaccines introduced by China and other nations, I'll speak from my experience. Africans have been used to using things that are developed by Western countries a lot, you know, because we are exposed to European and American media and everything. We're comfortable using it, and compared to China, it's because of, I guess, the relationship that we've had, or maybe it's the language barrier or something. Like, we're not like, Africans are not exactly used to receiving things from the East, and when those things are received, there's a certain stigma that is there about them. But that goes in no way to kind of like qualify or disqualify either, because at the end of the day, you're looking for the effectiveness that you're going to get from the virus. Is it working? Or the vaccine, sorry. Is it working? What is the success rate among Africans and everything? So instead of looking for where these numbers are coming from, these vaccines are coming from, I think the most important questions that we should be asking is, which one works best for Africans, you know? And that kind of like calls for for evaluation by, I guess, African governments or even individuals. You know, you want to get reliable information to make a proper decision so that you can at least voice out what you think. You know, you want medical expertise to be what determines what vaccine you're going to use, and not certain stigmas of whether is it coming from the East or from the West, you know. But sadly, those still exist. So I guess I don't know how we can really work on those stigmas, but the encouragement is just for everybody to just look at things objectively and not really as regional, if you know what I mean. So that's my response to your question, Nathan.
Thank you very much. That was a very insightful answer. Unfortunately, in terms of time, I forgot to mention restrictions in terms of responses. Each speaker will be allowed maybe 2 minutes to respond, but Chomba, I see that was a very structured response, and I think it was tied very deeply to the core of the question. And I think in doing so, you did answer the second question brought up, which is, is there an urgent need for the vaccine? However, for now, I think we'll move to the next question, which was directly addressed to the first speaker, so to Ovigwe, if you are still available. He asks, and this being Benedict, asks, my question is for the first speaker. Benedict, I do not see your question. However, there is
yes. Sorry, I'm writing my question. That was an error. I'm writing. I'll be through in a second.
Okay. Feel free to also speak it out, but also if you want to write it, I think it will be clear. So we can move to the next question while you write out. And so also your mic is still on, just a heads up. So to the next question then, brought by Patrice. He asked to the second speaker, which will be Lukmon, how have African countries been dealing with the socioeconomic consequences of COVID-19 in terms of job loss, no supply chains, and etc. Just another reminder, Benedict, your microphone is still on. So Lukman, do you please feel free to respond to that question?
Yeah, thank you so much for that. I would say that how would be that what I've been doing, and basically I would say that they are doing their best. At least we can see, like I said, we saw I just a couple of days ago, South Africa announced that they're out of recession. So while we may not say this is exactly tied to only pandemic, but it is also an effort to bring the country out of the economic downturn, partly caused by the pandemic. So this is also one of the efforts we could see. And however, it is still at a very low pace, because you see, in terms of policy-wise, we can see that most part of these economies are open now. You can see some flights, while there are still a lot of restrictions of people that can come in some part of the countries, but flights flights are now open, and you can at least fly to some parts of the world. They are now reestablishing. I read a couple of days ago that Lufthansa now go to Abuja, Lagos. So, and this is probably since February or March. So at least to a larger extent, things are coming up little by little. However, when you look at it in terms of job loss, and in terms of job loss, in terms of job creation, it will be grossly inadequate, to be honest, to actually say now what to actually assess their effort, because the pandemic is not totally out, and a lot of them still have a whole lot on their plate in terms of budget deficit. So probably we might have to wait till next year to see how some of these things will be addressed. However, it is too early to actually give a scorecard of how they are actually addressing it effectively now. However, we could see that they are now opening up little by little. The supply chain is now moving up, even though it is still not before the pandemic, but things are actually opening little by little. Education, for instance, is still at a low pace. So, and I feel that things are opening little by little, but it is still very early to actually give them a scorecard on how they are doing this effectively. So that's what I'll say about the question.
In line with that question, actually, another question is brought forward, and this is brought by Isaac, who asked that, what do you think then is the role, or what role, main role, does the IMF, the World Bank, and other multilateral banks play in curbing the effects of COVID-19 in Africa?
To be honest, I feel like these multilateral organizations, and of course, I will also say that China also, even though China is not, China and all our development partners actually fall into this category. So I would say that they have a huge role. A huge role basically has also always been, okay, them assisting us with funds. At least, like I said, a lot of African countries are running on budget deficit at the moment because they didn't plan for this pandemic. So a lot of people have actually deep hand into their forex in order to address this thing effectively. So there is need, if they could get support, that's why a lot of people, even when this pandemic erupted, a lot of African countries were calling for support. So support is actually needed. It might be finance. It could be either supporting, it might not be to the government, it might be to the people directly, to a lot of initiatives. So again, there is need to actually critically examine or look at if there is any support coming to the continent. How do they come in? They don't go, did they give us the support the way they give us traditionally, which at times it ends up in the hands of wrong people and it doesn't go to the right people. So again, our partners, Paris Club, World Bank, they need to also see how, they need to also re-examine their mode of giving support. So that's one thing I would say again.
Very good answer, I think. And at this point, I think also Benedict's question now pops up. And he asks,
Okay, I would like to, yeah, sorry,
like to
Albert,
say it?
I would just like, yeah, I would like to speak it on
Go
myself.
ahead.
Yeah, this is to the first speaker and the second speaker as well. It's like a mixture of both, because from the first speaker, he spoke about the economic impact, which was very interesting to me, because I actually realized the COVID-19 has more of an economic impact on us as to serious healthcare impact. So my question would be, could this COVID-19 become a catalyst for the decolonization of the African continent? Because I mean, we have all seen how the pandemic has shown austerity measures and lack of investment, even in the richest country in the world, like the US, can cripple healthcare systems. And as the second speaker just spoke about how some African countries are, defaulting on their debt. So could this crisis, while it might be very challenging for the moment for the African countries, could it not be a chance for us to become more, self-autonomous, and self-reliant? Yeah, that's my question. Thank you.
I think that's a brilliant question. I think, Ovigwe, if you'd like to go first, since we just had Lukmon speak. Once again, each speaker is limited to about 2 minutes.
Right.
So please feel free to go ahead.
Yeah. Thank you, Benedict, for that question. Well, I think the decolonization of Africa in the political sense has really happened. I mean, that's why, sorry, that's why we're independent countries today. But I think what you're trying to say now is the decolonization of the economics, right? And how we are going to create economic and development models
Yes,
that really
exactly. Economic
reflect
independence. Economic independence.
the needs of African countries. Because if you look at it, for instance, in where I'm from, the town I'm from in Nigeria, we've had the same number of primary schools and public hospitals since 1977. The same number. Now, do you know how much the population has grown in that time? It has nearly tripled, right? So that's how much deficiency we're looking at. That's just one town. That is replicated all over of Nigeria and at least for most part of Africa. The emphasis of the IMF and the World Bank on austerity, cutting public spending, has gutted state capacity to respond and effectively and competently address issues when they occur. Because what we find now is if you have the same number of public health hospitals, not just clinics, hospitals and institutions, as you've always had for the past 40 years, that is to tell you you're not building any form of capacity to deal with issues, whether it's in research, whether it's in just developing vaccine. I mean, some countries in Africa are actually working towards developing vaccines for themselves. Morocco, Egypt, and South Africa. South Africa being the only sub-Saharan African country that believes that has that confidence to say yes, we're going to be able to do this and try to do a vaccine by ourselves. So you have a whole lot of other African countries, 47 or 46 sub-Saharan African countries that have been independent for many years that cannot create any vaccine. Let me even give you an example. Nigeria in the late 70s and 80s, we were actually producing vaccine. We did trials for for smallpox and what do you call it, polio, earlier on. So, but all of that capacity has been eroded by decade after decade of structural adjustment programs, which really, I would say, destroyed and privatization, which really destroyed the healthcare system. Human services like healthcare and education, they are supposed to continuously be invested, in not using that as a way to cut public spending. So even Italy, Portugal, and all of the Southern European countries, it's the same problem that they're actually facing relative to Germany and other the richer Northern European countries. So I think when talking about decolonization, it goes down to the development model. We can't entirely blame these multilateral institutions because we caused the problem by even accepting their attempts in the first place. But I'm going to say going forward, African countries need to start rethinking and, like we say in the consultancy I work with, reimagining a development model that suits their needs. And right now, I think you'll see many of the African countries looking at how China did it, how Vietnam did it, how the Asian countries did it. And if you look at it to a large extent, it's about making serious investment into building public infrastructure and healthcare, education, transportation, bridges, power, and all of that. So I think we really have to reimagine our development model for us to really have a new system that works for us.
I think that's a very brilliant response. Thank you very much. Ben, I hope that answered your question. I think, Lukman, if you wanted to add to that.
Yes, no, I think I got the message. It's about laying down economic reforms, to transform the African market. So thank you for that response. It was very brilliant. Thank you.
Yes, a very wholesome response. And in fact, that might lead us actually to another question, since Ovigwe, we still have you on the line there. So Patrice asks again to Ovigwe, how many African countries are there among the top 10 most affected in terms of infection rate and death rate countries worldwide? So how are Africans looking in terms of affected by death rate and infection rate in terms of countries worldwide by COVID?
Sorry, please come again. I didn't hear that.
So the question is, on the list of countries that are affected by, in terms of infection rate and death rate, in the top 10, do we have African countries in that top 10? And where do African countries sit in terms of infection rate and death rate in the world?
Oh, so you're saying the most infected African countries?
Yes,
World,
in
if we're
comparison to the rest of the world.
in the top 10, yeah. Yeah, I think the countries that have really been hit the most are the countries in Northern Africa. So Algeria, for instance, Tunisia seem to have very high rate of infection, hospitalization. Algeria is actually going through a second wave, right now. So South Africa also, but South Africa's numbers seems better than Algeria. But by and large, if we're looking at percentage, of African countries in the top 10 most infected, there aren't any African countries. We're looking at total number per population, right? So, for instance, you can have the United States and India. For India, Brazil seem to be at the very top, whether in terms of total number of cases or even as if you correct for the population. So for the continent, I think the places where there's a lot of concern, it still remains in North African countries, particularly Algeria, Egypt, and Tunisia. In sub-Saharan Africa, South Africa. But South Africa's case is peculiar because it is testing far, far, far better, if not even the most, in sub-Saharan Africa. So when you look at the total number of cases there, it seems like it is worse, but that's because they are testing better. So if you test more, of course, the total number of cases will increase. Then the question now becomes, where are you seeing, the most deaths, of coronavirus in Africa, and it's still in the North African countries. So it's not to say there are no cases or problems in sub-Saharan Africa. Of course, there are. People are still dying here. Nigeria is near 70, about 60,000, in terms of total number of cases, and just if I would say a few thousand deaths. So it's still a concern. But like, look at the other factors that I've mentioned earlier, like youth population, the climate, and all of that. It still plays into the distribution of deaths. In Northern African countries seem to have a weather that is closer, to Europe, and that we have seen plays a role in the spread, of COVID-19. South Africa also has, a relatively colder climate in June, July, response, as opposed to other countries in sub-Saharan Africa.
Yes, I agree. And I think also we had just heard, I think there was just a document released by Southern African Institute of African Studies, I think. And they brought into the light that most of the cases in Southern Africa, especially in South Africa, are on the East Coast, where there is, particularly in Cape Town, for example, not in Cape Town, sorry, but particularly in the East Coast, where there's high rates of diabetes, and pre-existing conditions play a large role into COVID infection. So I think Ovigwe's answer is amazing, and it is a very key question to be asked. We will be having a last question. I now will let each speaker address this question. However, each speaker gets 1 minute, so we make it just on time. We've been doing really well on time in terms of questions and responses. I think the dialogue has been amazing. But Moho asks, my question goes for the first speaker. There has been a lot of controversies regarding the lack of adequate testing in Africa, which most people relate to the number of cases recorded in Africa being relatively low. However, as the first speaker addressed, there is a disparity of recorded cases based on region in Africa. How do we distinguish between the lack of adequate testing and the relatively low mass movement traveling across the continent, which has led to cases being high in certain countries and relatively low in others across the continent? So, Viva, did you hear that?
Yeah, that's a very brilliant question. Now, when it started becoming clear that Africa will not have the kind of numbers we're seeing in Europe, one of the very interesting articles that came out was written by our CEO Hannah Ryder and the Deputy Director Leah Lynch, and it was them trying to let the world know that the way Africa is integrated into the global economy is why we didn't even have the first case until February 14th. Meanwhile, you've already had coronavirus outbreak in every continent, every part of the world. Why on Africa didn't even have the first case yet? Because there's so much less movement between Africa and the rest of the world, and even within Africa itself. And it goes back to the lack of economic productivity, economic integration. Intra-African trade is about 15%. which is low compared to Europe that is averaging somewhere around 60%, and even Asia nearing way over 55%. So if you have a continent that is not very much integrated with the rest of the world, where majority of the people don't even move outside of their country all throughout their life, and then even within the continent, there is so little integration and mass movement between countries. You can take a train from France to Germany, from Germany to Hungary. Like Europe is so interconnected, so it's very easy for you to just carry cases. It's one of the disadvantages of integration. You can easily spread infection around the region, but we don't have that here. So that lack of infrastructure and interconnectivity, which has always been a problem for productivity of our economies, turned out to be some form of I would say buffer, right? But we don't want that. We'd rather have the infrastructure and connectivity between our countries and with the world, and invest in public healthcare and capacity building and readiness, early warning mechanisms, so that we can handle the any potential outbreak in the future, rather than say, oh great, this is one of the reasons to not integrate the continent further. No, not at all. We really should move towards better integration and better preparedness in the future.
I think that is a brilliant way to end this discussion. It fully covers the entire conversation of not just the health questions, not just the statistical numbers, but also the questions of income and how Africa plays a role in the global economy. Thank you very much. That is a remarkably profound question. And so as we build off of this conversation in terms of the regional dynamics of Africa, of the interconnectedness of economies, of infrastructure, of travel, of our people, I think it feeds largely into the discussion of the interconnectedness of Africans here in China. And so in line with that, it was with great pleasure that we are having this conversation between large, really amazing communities of Africans studying here in China. So a big thank you to PUASA, a big thank you to Development Reimagined, and a big thank you to THUASA for bringing this conversation together. It is an important question. I feel we've discussed so many really key questions and managed to shift through a lot of them in this limited time. I'm sorry that we're about 5 minutes over. However, I think it was worth it. A big thank you to our speakers. There have been multiple responses showing how the answers, the amount of concern and the whole roundedness in such a limited amount of time was definitely profound and helpful in terms of dialogue. And so thank you everyone, for those who are listening here today, for those who would be listening to this recording. It has been a great conversation, and at this point in time, feel free to find each other or comment your WeChat address or whatever you'd like if you want to connect, because one of the key things about meeting, which I've noticed with a lot of our African meetings in terms of other organizations, it's great for everyone to communicate and connect online. So we will leave the chat open for another 5 minutes if you want to connect with people there. However, for now, the conversation has ended, and a big thank you to everyone who has been listening, and have a great and wonderful evening wherever you are. Bye.